Two reports, both of which the US and the Iraqi government didn't want you to see, have uncovered crimes kept secret for over a decade. The findings, which come 10 years too late, speak of a prison underworld where atrocities played out daily at the hands of Iranian-backed and Iraqi-sponsored militias. US forces raided the Jadariya prison in 2005, where 168 prisoners were found languishing in terrible conditions. Washington called on Baghdad to launch its own investigation, stalled however by militia commanders who at the time formed an unofficial branch of Iraq's Interior Ministry. Three men in particular played an active part in disguising the truth: Midhat Mahmoud, current head of Iraq's judiciary, Bayan Jabbar, transport minister, and a commander from the Iranian-backed Badr Corps, the group now leading the fight against terrorist organization Islamic State. With those barriers firmly in place, Washington was driven to launch its own investigation. Their unpublished findings document countless crimes, deaths, and squalor, and those responsible, as evidence shows, are the same groups that the Iraqi state now calls an official security institution, the popular crowd. The 10-year gap for which their activities have been ignored puts pressure on Washington, whom many accuse of allowing these criminals to escape unpunished. FRB sources spoke to a former inmate at Jadariya prison. He described the raid as a cover-up, claiming that America knew the prison existed long before it was found. US officials told Reuters News that obstacles which prevented cooperation between them and Iraq perpetuated what is being described as a muted response to obscene realities inside secret prisons. Growing rates of kidnapping was as much as Baghdad would admit, with Badr organization calling the latest reports an attempt by terrorists to drag their name through the mud. Out of pocket and almost entirely withdrawn from the public sector, the absence of the Iraqi state has encouraged greater reliance on non-state organizations for medical services. The lasting costs of war scar the landscape of the oil-rich country, where more refugee camps are fast rising to house Iraq's growing refugee population. Healthcare is perhaps where the failures of government are most visible, as violence against physicians sees more of them seeking life beyond the borders of their motherland. The quality of medical services continues to decline while demand increases. Local NGOs have taken to the challenge of satisfying the immediate needs of internally displaced communities expunged from the areas overrun by Islamic State. But the collapse of healthcare stretches back to 2003 during America's invasion, a problem the current government has inherited but is unable to resolve. It is a desperate situation which groups like Dari organization are hoping to bring some relief to by providing assistance to 50 patients a day in the capital. This is their third year in action, and their mobile clinic allows them to reach greater numbers quicker. They have been pivotal in providing emergency services for cholera-stricken patients since Iraq's largest outbreak was announced last month. Not enough is being done by the government, especially for families dislodged from their homes due to the terror unleashed by the Islamic State. In an interview on Sumerian News, Iraqi Member of Parliament Lika Wardi accused Iraqi Prime Minister of disposing of his responsibilities towards destitute families. In the absence of political will and sufficient funds, it will take more than time to heal the wounds of war infesting Iraq's healthcare that was once the envy of all its neighbors.